Okay. Hello and welcome to the third session of this discussion series on the global challenges of the COVID-19 pandemic, organized by progressive online media portals based in 3 continents, NewsClick and People's Dispatch in New Delhi in India, Brasil de Fato in Sao Paulo in Brazil, and PATV Ghana in Accra in Ghana. I'm Satyajit Rath in India, and I will act as the moderator today. In this session, we will be discussing the political responses of societies and systems to the COVID-19 pandemic. While the pandemic has started at different times and has taken somewhat variable trajectories in different regions of the world, it's a public health problem sufficiently large in scale to have a great variety of impacts on societies and their governments. These are, of course, quite diverse across the world. Yet, COVID-19 is a common global issue, although many governments, especially in the global north, seem to have overlooked the commonality. It is therefore both interesting and instructive to look at how diverse societies and systems have responded to this common issue, perceived as one of clear and present danger, as the US Supreme Court memorably phrased such events initially. Now, of course, they use a different phrase. The phrase is historically appropriate in that it was, and in the present situation now is, meant as a valid cause for governments to suspend free speech, civil liberties, and human rights, all of which become issues when we discuss the political response to the pandemic. To discuss these issues, we have today with us, we hoped 3 activist friends, but I will come to the modification in a moment. Activist friends from 3 continents in keeping with the breadth of our tricontinental footprint in the global south. 1 from India, 1 from Colombia, and 1 from South Africa. They will talk about what the response to COVID-19 has been and what the current pandemic situation is in their country and in surrounding regional countries. And they will locate these comments in the larger issues of health access on the one hand and of political systems and societal structures on the other. Hopefully, this conversation will help us learn from each other and facilitate a global understanding. So let me first simply lay out an introduction of the speakers. The speakers today will be Yogesh Jain from India. Yogesh is no stranger to this series. He's our own in India. But very briefly, he's a physician and a pediatrician who co-founded Jan Swasthya Sahyog in Bilaspur in Chhattisgarh and has worked as a grassroots health activist, has worked in participatory public health and the healthcare rights of the most poor and marginalized communities in India for over 3 decades, with, I think, 2 of those in Bilaspur in building Jan Swasthya Sahyog, if I remember correctly. Our friend from Colombia is Carolina Gomez. Carolina is a lawyer with extensive experience in pharmaceutical policy. She earned her basic law degree from the Universidad de los Andes in Bogota in Colombia, and master's degrees in law, 1 from that same university and a second one from the University of California in Berkeley. She has served as a senior advisor to the General Directorate of the National Institute for the Surveillance of Medicines and Food and to the Minister of Health in Colombia. She was the Director of Medicines and Health Technologies at the Ministry of Health in Colombia. She founded the Medicines, Information and Power think tank at the National University of Colombia, where she currently works. Our third speaker was to be Sibongile Shabalala from South Africa, who has had a family medical emergency and who is therefore currently not with us. She and we are both hoping that she will be able to join as we go forward in this session. But we will see how that goes. Our thoughts are with her. Sibongile is the national chairperson of the Treatment Action Campaign, TAC, since 2017, having worked in that group for a long time. And she's a positive inspiration for people living with HIV and a social justice activist on health and rights issues affecting women and poor. And her leadership and voice has raised awareness at local and international platforms. And she's an honorary fellow at the Steve Biko Center for Bioethics. And once again, we hope to see Sibongile with us as the session moves forward. Now, having made my initial comments, what I will now do is invite our speakers, both Yogesh and Carolina, to make their first comments in about 10 to 15 minutes about what the response to COVID-19 has been and what the current pandemic situation is in their country and in the regional countries around. And then we will come back and get deeper into specific issues and questions. Speaking of questions, for all our audience on Facebook, on YouTube, anywhere where you're watching us, please write your questions in the chat boxes. We have people working behind the scenes who will get the questions to us for the discussants to address as we go along. So by all means, please write in questions. With that, let me start by inviting Yogesh to kick off the discussion.
All right, thanks for this. And I would say that in India at the moment, on the South Asia region in general, we are in a situation of a surge, certainly in number of cases, and India has climbed up from a situation of 50th in the number of total patients diagnosed to being number 3 at the moment, and yet it has not reached its peak. We expect the peak to even come in a few weeks from now. But as we speak, yesterday we had more patients diagnosed in this country, in India, in 24 hours than the entire China country had it in the entire pandemic till now. So we had close to 90,000 patients, as China reported a total of 85,000 till now in the entire 6 months of pandemic. So the situation is, dire, likely to become worse over time. Yet we still report and we sort of, bask in that glory that we have a lesser percentage of deaths among the people who are diagnosed. So about 2% of there's a 2% death rate reported at the moment in the country. And but the independent report suggests that probably it's 5 times higher in the country because of gross underreporting of the percentage of deaths. Yet at the same time, it seems that the sero surveys that have been done for the evidence of past infection in various cities of India, that 2 to 25% of people are already infected. That means that the virus has already been among the various urban people throughout in the country, in all parts of the country that they have done the sero survey of. And yet, as I must say, that India being a rural country, predominantly 69% being rural, the disease is still largely in the cities. It has come down from the metros to the smaller cities, but 90% of infections still are among the urban people. And it remains to be seen when it really reaches the rural areas, what will be the impact of that. As well as at the same time, the testing in the country has increased, a point of contention and worry for most people, but it is still very uneven and it is not still adequate. And yet there is clear evidence that in some states of the country, where particularly which have poorer health systems, that they're doing much worse in terms of testing and treatment. At a system level, the country has, it maintains a focus of very centralized care, centralized decision making, as well as, very poor information sharing with the community, and yet a lot of reliance on technology to ventilators, PPE, as well as repurposed drugs in being able to manage the pandemic. And there's largely an effort at obfuscation of the current situation's burden. The states, there's a central command because the country has invoked an epidemic control act, wherein the powers are vested now in the very centralized way, with little power in a federal structure for the states. And yet there are states with their constraints on their finances are expected to look after the health problems, and there is a problem in that. But I would say another issue that has happened is that there is a lot of system fatigue that has set in. 6 months of people trying to do actively has led to fatigue in terms of what they can do. And the system is not used to fragile system is not used to handling more work in an aggressive way. But as a consequence of whatever has happened, the health systems which have not been able to provide adequate care for COVID, but they have ended killing on COVID care for other illnesses, has been a major consequence of this. At the level of the government, I would say there's a lack of trust in what the government is doing with the people, and there's a bilateral lack of trust. The state feels that the people cannot be trusted to take decisions for themselves, and therefore they have not invoked community participation. And the community feels that the state is not owning up and is not doing the responsibility that it should be happening. The economy has taken a major hit, a massive hit, if I may say, and I feel that we may not ever recover from this, at least in the next decade. And the state has pumped in a fiscal stimulus that was, mainly to underwrite the requirements of the corporate sector, not so much to aid the people during the period of, economic downslide. And the proposal that they took it from the international level of locking down people's movements and livelihoods due to locking up people in their houses, which was done at the wrong time in India, and we can talk about it a little more. And largely, it has become a police state, I would say, in terms of using the garb of trying to control the pandemic. And so the other trend that one has seen in India, at least, it has been an unscientific response. The non-science and anti-science, approach to the management of the pandemic, as well as whatever else goes on in terms of decision making for economy or other ways. There has been a clear supporting of these private systems with lack of trust and lack of building up the public systems that defines the response of the state in India, at least. And finally, blaming the vulnerable, the community, for what they are doing, that they're not wearing the mask, or blaming the Muslims, as it were, in the month of March and April for the spreading of the pandemic, which they failed to control, or people who are otherwise in service works like vegetable vendors, or people who support who are life makers in the community. And if I may go down to the other countries in the area around, I would say Pakistan, which is our nearest neighbor, which is far poorer as a country and has poorer health systems, has surprisingly done better than us. And in fact, they have been able to buck the trend, and the surge has not happened very much. The numbers of the proportion of people infected, or the numbers of people who have died in that country, are far fewer than their big neighbor that India is. And at the moment, and possibly that has happened because they use a smarter way of managing the pandemic, and as their own premier called it a smarter lockdown processes that they did, which we can talk about more. The testing is still poor in that country, and the systems continue to be poor. So non-COVID hit has been large in that country, but at least in terms of COVID response, they have done better than India. Compared to this, the other countries like Nepal are doing moderately well, but could have done better because they at least had a more socialistic government in place, and they have deaths like any other North Indian state in India. Compared to this, Bangladesh and Sri Lanka have done rather well. Bangladesh particularly, their lockdowns were clearly better planned, and they did not disrupt the lives of people as much. And in fact, Bangladesh would stand out in their response in this case, in the South Asian, peninsula. And I would say Sri Lanka, yes, there have been criticism of its over militarized response to care, but they have, in terms of controlling the pandemic, they've not done too badly, and certainly better than their large northern neighbor. Go further east in Asia, in the countries in East Asia, Philippines has done it, has it really bad, but they also use an extremely strict lockdown, a very militarized one, and it has already become a police state from worse from what it was, and it has unleashed untold misery on the people. And they have, been very harsh on the media and on the civil society in at large. But compared to them, their Western neighbors, Laos and Vietnam, have done exceptionally well. And possibly the reasons why they've done well is one, that they had some previous SARS epidemic. They knew, so they had built up public health systems and processes that could, predict and do a surveillance of the onset of the incoming of the pandemic in their country. And they had a large coordinated response where they invoked even at a centralized planning, but the execution was largely at a very decentralized level. And at the same time, they were champions of tracking and tracing of people. They did up to go to a third degree of contacts, from primary contact to secondary contact to contacts and contacts of contacts, and they could control the pandemic to such an extent that I think they would shame most of the large, much more resourced countries in the world, even in the neighborhood of other Asian countries. Except Indonesia has done in that sense poorly. And I would say Thailand and Malaysia comparatively also have done reasonably well, possibly because they have robust health systems and they had experience of the past SARS epidemic. And so have Singapore and Korea for different reasons. One, they could put in more money into the management of the pandemic, but also they use some smart techniques of contact tracing and testing. But Indonesia, neither Myanmar have done well, for which reasons we can discuss. But I would say overall, India as a second largest country in Asia, has suffered from it was a crisis that had to happen. I think it could have been foretold for very good reasons. The way that we did not use the principles of science, as well as of community participation, as well of decentralized execution of work. Yeah.
Thank you very much, Yogesh. You've raised a number of questions about political systems and efficiency, about rural-urban divides, about what sort of community participation is turning out to be more or less useful, and a whole host of interesting questions that we'll come back to in a moment. And now, I call upon Carolina. You're muted, Carolina. You have to unmute.
Thank you. Thank you so much for inviting me to this talk. It's super interesting, and this, tricontinental effort, I think, is super worthy in the sense that we all share similar characteristics in terms of poverty and development. So it's good to share. I think many of the things that Yogesh said have been have happened here in Latin America too. I wanted to comment on lockdowns a lot because it's been a measure that has been very widely used in Latin America and very long. So we've been in lockdown since February or March, and we're still in lockdowns. Just in the past few weeks, they have started to to relax, of course, in the paper, right? Because many people have not been able to comply with the lockdowns, and I will get there in a minute. But first, like, lockdowns were proposed in the region as a measure to prepare the healthcare system, right? So they said, oh, this is going to be temporary, so we're going to strengthen our healthcare system, we're going to buy ventilators, we're going to build hospital beds, ICUs, etc. But then it became the measure to address the pandemic, right? So it was almost the only tool at hand for governments. And it's still not clear if these lockdowns have worked, right? So there's a loss of legitimacy because we're still, people felt trapped and locked, and we're still seeing an increase in the number of cases, right? And this is paired with police measures to enforce lockdowns, and they vary in the region. I found a really useful map. I can show it later, or maybe send the link in the BBC news portal for Latin America. It's an interactive map showing the different levels of tightness in lockdowns in the region. But we've seen countries that have, even in Colombia, started criminal prosecution against people that have broken lockdown. So it's a crime, but also fines. Fines is the most common the most common measure. And we now see, of course, as everything with poverty, is that these measures, even the fines and criminal actions, have stricken the poor the most. And of course, the poor are getting sicker, right? So because they cannot stay at home, they cannot afford to stay at home. So this is paradoxical, and I think it's a reflection that started since the AIDS epidemic, using police to enforce public health measures. But it's something that, for us activists, we need to remind ourselves and remind governments that using police and force and enforcement of the law for public health measure is not effective at all. And we have seen it in this pandemic very clearly, but it doesn't seem to get in the brains of many of the governments, of politicians. And sometimes, I feel a little empathetic in the sense that many of them were so overwhelmed, and like they felt, what do we do? This is what we do. It's a lot of improvisation. And one particularity here in the region is that Brazil and Mexico, which have governments that are at the opposite of the political spectrum, so Mexico has a left government and Brazil has a right government, have had similar postures for the pandemic, right? So they haven't enforced strict lockdowns, of course, but the speech is very different, right? So in Mexico, they said we're not, we're going to help people, we're going to try to get social aids, etc. Whereas Brazil is like, we cannot stop the economy, we need to save corporations. This is just an invention, it's just a mild cold, right? So that's interesting, and it's something we've seen in Latin America also very common, is contradiction between national governments and local governments. We saw it in Brazil very clearly. The governments, the governments of the states, it's a federal state, because the president didn't want to, enforce any strict lockdowns. So they said, okay, in our region, we're going to do it. And that has sparkled a lot of litigation and like this rich creation of law, which interests us as lawyers, right? About who has the power and who's more legitimate. In Colombia, we've seen it clearly also with the city of Bogota, the city of Bogota has a really progressive major, and it's of course an economic force of the country. And they have had clashes with the national government, who has seemed less structured and less planned than the local government. But that's something that we've seen all around the region, right? This difference between the national government and the local government. So it's also a fight for power. So these are also politicians that are thinking in the future, and they're thinking, oh, I might want to get elected later. So this is my time also, right? So there's a lot of politics thrown in here in Latin America, and also with all the social measures that have been put in place. So aids, subsidies, it has sparked also interesting debates for universal basic income. So in the region, especially in Colombia, people have started to discuss, should we have an income for everyone that's guaranteed? So some people say, no, not for everyone, because some people don't need it. And then the others say, yeah, but if we start differentiating, it makes so hard to enforce, and it's, it makes it prone to corruption, because then you need to convince someone that I follow within the criteria, right? So it's better to have it universal. But I think that's a social conversation that it's super important for the region, which is one of the most unequal regions in the world. And of course, the pandemic has shown and has highlighted these inequalities that we have here in Colombia. I think another huge issue, and I think Yogesh mentioned it, is the state of police, but it's a state of police where society participates, right? So it's not just the police or the government, it's the neighbors telling on other neighbors. It's people judging other people and policing them, right? And it started a division, even a political division in the country and in families. So I think that's a harsh weight that pandemic has thrown on us. And so now, like, if you gather with people or if you're a party, then you're newsworthy and you're like super bad behaved. And then so there's a moral issue, it's a moral cloud that is clouding our skies, right? And it's very hard to tackle and to communicate why people do not follow sanitary measures, right? So in a divided country, Colombia, it's a very divided country. We've been at war for many years. We just came out of a peace process that was super divisive of the society, and it's failing. We're seeing violence again. We're seeing areas of the country where there's a fight for social control between the government and the armed forces, the armed groups, and with also the mafia and drug cartels. And the pandemic has been an excuse for social enforcement. So we saw 2 weeks ago, we were in shock, some young people in the countryside in the south of Colombia got killed, actually, because they were gathered in a party, and this one of the groups that is trying to own that territory after the peace process, because the state was not able to bring the institutionality to these states. So these people are fighting for social control. They just killed it and killed these young people and said, you were partying, this is wrong, so you disobey, right? So the fight for social control is also one of the things that has this pandemic has shown us. And I think I will leave it there, because we have a lot of time to talk later and maybe go deeper in many issues that I mentioned.
Thank you very much, Carolina. And that brings us, having laid the ground, as it were, and I'm really missing our comrade Simangile Shabalala, since an African perspective would be absolutely invaluable at this juncture. But anyway, let us try our best. So I'm going to mix and match questions. So first of all, I'm going to take a couple of questions that have come up and get, since they are primarily addressed to the Indian experience, get Yogesh to respond to them, and we'll then take questions further forward. I have questions to ask both Yogesh and Carolina. So for Yogesh, let me ask the question that has been asked from our audience, which is, do you see any change in the outcome after 3 or 4 months with the rise of testing, with, quote, improvement, unquote, of health facilities? Do you at least expect things to improve by the new year? So look in your crystal ball and tell us.
I think it's too long, too much in the future to be able to say anything. And I think for anyone to say what will be the duration of the how long we might reach the peak in, and when would the peak become a plateau, and when would the plateau start coming down, because we haven't used this period of of a strict lockdown to build our systems, which was already fragile. But neither have we invested any more, nor have we added any of those technical inputs in an adequate fashion for managing the pandemic. But at the same time, we are suffering the consequences of a breakdown of whatever vulnerable system that we had in terms of major non-COVID level mortality. And because of obfuscation, I would have said we should have gone for detecting all-cause mortality rather than only mortality due to COVID. And I think to be able to, the actual real, I would say, music in a sense would be there when the disease hits the rural Indian people, and where I think at the moment it's only a 10 or 20% people who are being diagnosed come from rural areas, and where the concerns, where the systems are poorer, people have less resources to handle them, and our health systems actually are at the moment don't have even a clue to how to handle rural problems. And all the suggestions that have come either as a hand down from the transnational daddies of health like WHO or from the Western world are all targeted at urban populations. So I think we need to be rather braced. We need to brace ourselves for what is going to come and to escape the minimum amount of damage by mitigating it, rather than hope that in a certain number of weeks or months we are going to be out of it and back to glory.
Thanks. So let me extend this question to Carolina in the context of Colombia and Latin America. Do you think that, at least for Colombia, is the system a little better geared over these months for addressing the pandemic in at least a healthcare context? And is that a feature of how you think the next couple of months will play out?
Yeah, well, I think we have strengthened our capacity, definitely, diagnostics capacity. It's still not enough, right? And I think this is the problem that you mentioned there in India and also here in the region. We don't have a clear picture of the pandemic because we do not conduct the same number of tests. Some countries do better, some countries do worse. Even those who do better in the region do not do super well, right? So this is, my other area of expertise, intellectual property and lack of access to testing. There were no testing in the world. Even if you wanted to buy them at the best price ever to Roche or whoever, they just didn't have it. So we had to, do like that, do no testing. But we have created testing capacity in the country and in the region that has strengthened amazingly. We have strengthened our high complexity capacity in infrastructure. We were discussing this at the beginning. And we've seen some small cities in Colombia that now have IC units that didn't before. But they probably, after the pandemic, will not really need them. So we are investing all this money in super high complex infrastructure, whereas in the rural areas and also in very poor areas in the cities, what we need to strengthen is primary care, prevention, promotion, right? So I think healthcare systems are getting strengthened, but not in the way is best, right? So this is a dilemma. What's going to happen with all those beds and ventilators if the pandemic passes? Are they going to go to waste? And we still haven't solved, sanitation and water for many people. So this is the dilemma of high technology and complexity. And I think a lot of belief, at least in Colombia, there was a huge political fight around ventilators, and many people were saying, okay, yeah, we need them, but we haven't solved primary care. We need to, bring water to people. That would be more effective than, discussing if the ventilators. So there's this trust in technology that we have all seen in the pandemic, in the vaccines, in the treatments. And I think that's not quite accurate, that we should be relying in technology so much for healthcare. I mean, healthcare is not only technology, it's just a small part of it. So I guess we have strengthened, to answer the question, but we haven't strengthened in the way that helps people best.
So let me take off on both your responses and connect them to the questions that are coming in. So my first question is about something that Yogesh implied and you, Carolina, made explicitly as a point, which is about the volume of testing. So let me expand that into the question of, if countries are not all testing at the same levels and along similar plans, how reliable are the data about the pandemic, both in terms of people affected seriously, as well as even the numbers of people dying of COVID-19? How reliable are the pandemic statistics in any of our countries in the global south? Yogesh?
Yeah, so I think much has been spoken about testing. We certainly are testing more than what we were doing before in this country, but still it's not adequate given the size of our population. But the other problem that has happened is that choice of testing has also, been controversial. How sensitive a test sensitivity? What is the test sensitivity when you start using it? In this case, we have largely started using antigen testing, which has a sensitivity of less than 50% for the diagnosis of COVID. Not that PCR is a foolproof test, but so the antigen testing has been used as a means to show larger usage of it, is being shown the commitment of the state to the process of testing, because testing has been one of the mantras that WHO has been speaking loudly about. I would say that another problem about testing is who's being tested. I see that a lot of tests are being done on which are not very productive. They're being tested on, people who are asymptomatic. Whereas when we know that, yes, asymptomatic people do transmit, but the transmission rates are much lesser than those by symptomatic people. And symptomatic people are not.
Did we just lose Yogesh?
The treating teams in hospitals feel that if they. No, I'm there. Yeah.
Go ahead.
So they're not testing as much among symptomatic people because they would have to otherwise care for them in isolation or treatment or in hospital facilities. So I think when you have not taken the health workforce into confidence, first by providing them adequate support, prevention, and treatment facilities also for their own care, and I've not looked at other requirements that the teams have, you are likely to get people gaming the system in a sense and using testing only as an optical measure rather than as the purpose that it should serve. So the short answer to your question is obviously the data is less reliable when we talk about the virus or the antigen testing. But another way to look at if you need to do a surveillance of the transmission of the disease in the community, then antibody serology testing is another way, which is being done in India off late a little bit more, but it doesn't still seem to have fit into a very organized pattern. And they have been very cagey about publishing those reports because that they show some of the the ineffectiveness of the lockdowns that was an optical measure in the first few months of the pandemic.
So, Carolina, to ask this to you a little more specifically, how much is the kind of stigmatization and active avoidance of testing that Yogesh alluded to affecting testing statistics and therefore disease statistics in Colombia and in your opinion?
Yeah, I think it's affecting it a lot. I don't think they are deliberately not testing for just not to provide care. Well, yeah, some people, I mean, it's hard to say because we have private insurers, right? So it's not we have universal healthcare coverage in Colombia, but it's through private insurers. So the main problem with testing in Colombia is how delayed the results are getting. It's 3 weeks after, right? When I mean, if you were gonna die, you died, and if you were gonna get better, you got better. So there's no point. I mean, this tracking, tracing, testing method that it's advocated for by WHO, it just is not working here because we're not getting the results on time. And so at the end, you really don't know what's happening here, right? And I think no country has a real clue of how it's going on. I don't really, these comparisons of which countries are doing better or worse, I don't think they're useful at all. They just scare us, but we will need to see at the end. I mean, we're taking pictures, small snippets of in time, and then we can make comparisons there. But we will only have a certain picture and not even completely certain at the end of the pandemic. So it's just something that sometimes I feel overwhelmed of how this is like a tsunami that fell on us, and we're people are doing their best, but governments are weak also, and I don't think if you are a country that is developing, you cannot behave as developed in 3 months, right? Like get the testing. So all the problems that were there are still there and are going to show up. So I don't think we can rely on testing in the region. The differences between the measures and the quantities of testing in the region are huge. And so these data are not reliable, and these comparisons are done with the data that's available. And even some countries, as Yogesh mentioned, are not transparent. So this also, throws in more lack of less confidence on the government and the information.
So let me pick up the point that Carolina made about the WHO preferred modality, which is intensive testing, contact tracing, and specific high-risk contact isolation as a method for containment. And let me connect that to a question that we've had. So I'll read the question, but I'm going to reframe the question. Would the situation have been worse without Arogya Setu? Arogya Setu, Carolina, is a cell phone app for contact tracing that's been promoted by the government of India. How useful is contact tracing? Who is responsible, state or citizen? And is it being done the right way and uniformly across all states? But what I would like to do is to reframe this in just a small modification, which is there seem to be two ways of thinking about contact tracing that governments across the world are using. One is a digital world, technology intensive, almost top-down modality of contact tracing. The South Koreans seem to have used this, at least in the early months, with both social sanction and to good effect. It doesn't seem to have worked in many other places particularly well, and clearly it has raised issues about human rights, privacy, and related matters. On the other hand, community outreach, sheer human resource, community participation, community outreach-based contact tracing has been in small-scale models, both in the global north and in the global south. Really small-scale models have been reported to have been effective. How do both of you see this almost dichotomy of a centralized top-down digital control tracing model and a granular decentralized human resource neighborhood community intensive contact tracing model with the experience in your own regions? Yogesh, if you want to start off.
Yeah, I would say, first a word about this entire combination of this testing, tracing, quarantining, and treating. This has meaning only if the correct type of test is done on the correct type of people, and then the reports are available in time for the correct response to be done, and that is done finally in a human way. Now, of all the things that we discussed in the last question, if the reports don't come in time, where do you keep the people who are tested but not reported? If they're symptomatic, if they're asymptomatic, and are they mixed with people who are already diagnosed to be diseased? So all those questions come up. And until unless this strategy, the technology of testing is not smoothened out and optimized, the use of digital technology to do contact or digital or otherwise becomes has less meaning. I would say digital technology has a role, but only if it could be done with all the advantages, all the necessities of controlling people's lives or in helping them ensured. So I would say, as an example, in Vietnam, they've done one of the best contact tracings, where they used a digital technology also, but it was equally matched by a human contact tracing and they, as I told you earlier, that they did a third level of contact tracing they could do and stem the problem. And I would like to add here that this idea of tracing, contacting, and testing is useful in the early part of the pandemic. Once the disease has gone into a major spread, like it has happened in India, the testing has to be tempered by the amount of money that you invest in it compared to the requirements for managing people who are already sick, because the pot that you use the money from is limited. So I would say, and contact tracing, one of the best examples by manual form has been in Kerala in India, where they've used the local self-governments and the community teams, community volunteers, to trace everyone, again, at least to the second level of contacts. And they've done very well. Arogya Setu, the Indian app, has been used partially. It has not invoked a lot of confidence by the community, people at large, and it has had a lot of technical glitches also. So it has been partially useful for some people, and I don't think it has served the purpose that it could have, with all the attendant concerns that it threw. Except for this, I don't know of other countries that have used any apps, any digital technology to trace in a significant way. I think most people were focused on mainly testing rather than tracing and contacting through digital routes in South Asia, at least.
South Korea certainly used.
South Korea certainly used it and so did China in a way.
And so did China. So did some European countries. What's the experience about what I'm calling top-down digital versus community in Colombia, Carolina?
Yeah. So I'm going to divide my answer in two parts. So the first is what has happened, and then my take on that, right? So what has happened is that the government and also local government cities have developed apps, right? And in some cities have made it strict, like two cities in Colombia, Bogota and Medellin, which are the two largest cities, tried to make it compulsory for you to enter the data. So if you were out on the street, a police person could stop you and tell you, show me that you enter the data, and you have to tell the government you were going to visit your aunt or shopping or whatever. They tried to do it. Of course, this raised a lot of concerns. Like people said, no way, this is illegal. I mean, this violates all sort of human rights. I don't want to tell you my information. And there's been a lot of litigations are starting around it. So the city of Bogota, backed and said, okay, this is voluntary. The government has developed an app that it's also voluntary, right? So, and they've tried to put it as a condition for doing something else, right, to make it compulsory, but it hasn't really stick, because people have risen their concerns, and so it's not effective at all. I mean, there's information there that could be useful, but it's not like super reliable because it's all voluntary, right? And my personal take on apps, I'm super torn about it because I see the potential for public health, right? So I see how this could help, but it's so dangerous, right? So, and what scares me the most is not how the government would use that information, but how people are willing to give their information, right? To say, oh, because we're in a pandemic, then all of a sudden, my privacy doesn't exist anymore. And it has happened not only with apps, but with many other issues, like people have renounced their rights. And these rights here in Colombia have cost us blood, or even in the world. So I'm worried about this state of how fear makes people willing to give so much up, right? And I feel that's the danger with apps. Some people here in Colombia have argued, and I guess in the world, oh, but you've already given all your information to Facebook and Instagram and Twitter, so what's the point? I mean, you will give it to someone else, so who cares, right? And so it's also an interesting debate that the pandemic has started. I would answer to them, well, these are corporations and they should be held accountable, and if they're not, we are going to make the government make them accountable. But the government, just because some corporations do it, should not say, oh, they do it, it's fine, so we will do it too, right? So we still have social liberties that we need not to forget that we have earned with blood and effort.
Thank you. So I will bring our conversation to the ideologies of governing systems and how those have shaped and been shaped by the pandemic. But before that, let me ask a specific question that has been asked of Yogesh. You commented that Pakistan is not doing as much testing as India, but you also said that Pakistan has taken some smart steps which Indian administration has not. And that seems to be a little bit at odds, those two statements. So could you explain that a little? What sort of smart steps has Pakistan taken?
So I didn't say a smart step, but a smart lockdown, as they use the word for themselves. So the lockdowns have not been, complete lockdowns of all cities and the rural areas. It has been dependent upon the number of cases diagnosed in a particular area, for certain categories of people, and supporting people when they are locked in, so that they are not forced to move out or break the lockdown. So that has been a problem with the management of our lockdown, which was actually at one level one of the most draconian and at the same time ineffective also in many ways. For example, if we knew that the largest number of people who were coming in initially were from international airports as well as some other transit points, we should have done those attempts better at screening and locking down those sites rather than locking everyone under with a one size fits all idea. And I think so in short, what Pakistan lockdown process was more nuanced, and it varied according to what was the need of a particular geographical or a social formation, how to lock it and to support people during those lockdown process. I don't think otherwise they had. Not testing enough was not certainly a smart measure, but the fact is that their disease has certainly come down and their deaths are also less, and deaths of all cause deaths also can't be hidden. So it seems from all information that comes in that Pakistan, the disease has certainly really has ebbed and come down drastically.
So let me now take us to the issue of the socio-political ideologies of governments and their responses to pandemic and the policies as well as the implementation. And Carolina made an extremely interesting point from which I would like both of you to comment further. She pointed out that Mexico on the one hand and Brazil on the other hand one has a left of center government, one has a far right government. Both of them had a number of pandemic policy related similar perspectives. And yet there were interesting differences that were driven, at least indirectly, by ideological considerations. How do you see, broadening that perspective a little bit, how do you see the ideologies of governments as shaping their response to the pandemic? in terms of both making policy and in terms of implementing it?
I think you already answered part of the question, but from a reading of the evidence that seems to come out about 8 months into the pandemic, that it seems that those countries in Asia, at least, which have centralized power structures, along with little involvement of the people in the processes of governance, as well as execution of those decisions, and secondly are a far right in their political ideology, have done poorly. There is no doubt about this. So India lately is far more centralized than the federal structure that we had. Philippines, these are two countries that have done rather poorly. At the same time, there are some left, some socialist governments like of Laos, Vietnam, China, and our own Indian state of Kerala. They have done reasonably well, not because only that they had the interest of people in their stated ideology, but also that there was a lot of community involvement. Through whatever formations of people's groups are at the variables, even though some power may be centralized. And I would say the third ingredient which led to a decision, which led to whether who managed pandemics well, was the presence of a health system before the pandemic hit the countries. A good system and good processes. Processes would mean surveillance, care provision, primary care structures of health workers, volunteers, nurses, primary physicians being there, and and the ability to listen to supply chains being managed very well. Those systems were wherever they were doing well, even in countries which had a capitalist economic base and an ideology which was a non-socialist, like like Korea, Singapore. They have done well. And those countries that were inside of the political ideology, but had experienced, a past pandemic, and therefore felt there was a need for a public health system, and they had invested in it, like Ireland or Malaysia in that sense. And I would say, Sri Lanka, or if it is, let's talk about, the Korea and Laos and Vietnam, those who had faced the pandemic performed better. So investment in a public health system over time, adequate financial as well as technical and care. Those societies those countries that have invested in them have done well. A reasonable counterexample would be Nepal, which has a left communist socialist government, yet hasn't done so well as the other socialist governments have done. So I would say, but China is a textbook example of how a socialist government, along with community participation, can do very well, for all of us to learn from it.
Thanks. Carolina?
So yeah, I think I would agree with Yogesh a little bit on how probably right-wing governments, if you see in Latin America, have done worse than center or even left governments. But I think there are two ingredients that make that more complex. First is, of course, that countries that have done worst in the region, like Brazil and the US, are governed by right people, but I don't think it's only like the right politics, but it's also science denialism, right? So it's leaders that deny science, and we have more moderate right leaders in the region that do not deny science, that have actually surrounded themselves with physicians and epidemiologists, right? So and they listen and take advice from scientific people. So it's not only right, it's like also a characteristic of these leaders that are like sort of populist, right-wing populist, which is super, it's a new figure in the region. We have seen left-wing populists in Latin America, and we are used to it. But right-wing populism is sort of new in power, right? We've seen it maybe, being normal politicians or in the opposition, but now in power, it's something new, and we are seeing how bad it is, right? And I think the second ingredient that makes it more complex is that these political ideologies in power determine not how much the response in terms of healthcare. I think what Yogesh mentioned is that it also depends a lot on how strong the healthcare system was before. And I think all of the governments in the region have agreed that they need to strengthen healthcare, and they have destined money for healthcare, right? But I think what differentiates them is their measures and public policies in other areas like social policy and the economy. So how would they face the economic paralysis, right, and poverty? And the right-wing governments in the region believe that they should help corporations, big corporations. So they will give buyouts and loans, right, to big corporations. We've seen it in Colombia also, in this difference I mentioned before between the national government and the city of Bogota. So Bogota has been very effective in giving subsidies to people, right? And giving food to people. And the government put in place supposedly a program to do that, and they are giving subsidies to people and money and food, but of course not as much as they are giving to corporations. And they gave a lot of money to the banks, so the banks would loan to small enterprises and to businesses that are small, and the banks didn't give it to people. So the government gave the money to the banks, and the banks just kept it because these people are not reliable. We cannot give loans to small businesses, they will not pay it, it's too risky, right? So it's been outraging to see that they are bailing out, for example, an airline. The government is going to bail out an airline that used to be Colombian. It's not Colombian anymore, it's Panamanian, and they're going to give a huge loan to them. And so I think the difference between right and left is not seen, or at least in the region, is not expressed on how much money or they've strengthened the health system, but in these other measures.
Thank you. I'm listening to perspectives from Latin America on the one hand, and India and South and Southeastern Asia on the other hand, and I'm really missing Sibongile Shabalala more and more, because an African perspective would have been so very illuminating for us. So it's a great pity. Let me, in the final stretch of this conversation, let me ask both of you a question about future trajectories. Not about how the pandemic itself will play out, but about three features that seem to have emerged. One is that there is an element, as both of you at different times have alluded to, of government paternalism, as Carolina put it, the government will and ought to take care of this. And that has its own consequences in long term for human rights and the politics of protest on behalf of marginalized groups. The second component, as again both of you have pointed out, is that the restructuring of healthcare in response to the pandemic has been disproportionately in favor of the high-tech tertiary care component and not at the level of the primary care component, with consequences both for COVID-19 care as well as for non-COVID-19 healthcare. And the third is the socio-economic inequalities, both driven by the stigmatization of communities as well as by the growing economic disparities in response to economic breakdown during the pandemic. All these three directions are depressing prospects to think of as the consequences of the pandemic that will be with us even when the pandemic subsides. How durable do you think these depressing trajectories will be in your countries and communities and in your regions? Yogesh?
I think hugely in one word, but taking on the three points that you suggested, I believe, like all of us would, that it is the primary responsibility of the state, of the government, to fund and also in terms of many social activities, provide care such as in health, education, and other basic services. The fact that that journalism has otherwise would not work. The fact that they need to support and provide curative care or preventive care, money for preventive care, has to be the responsibility of the state. But to take on the responsibility, to take on and assume that the community has no role is a dangerous thing, and it without that it is unlikely to be able to work in any country, and certainly not in India. And I think this has serious consequences for future, where you almost deny the importance of the diversity of communities and their context specific needs, as well as their power, as their strengths also, to be able to manage not only the pandemic but the impact of the pandemic on people's lives. So and I think this I'm worried that this is going to lead to a very dangerous situation. Regarding investments in health systems per se, I think we are going to be left with a lot of post-COVID waste in form of a lot of ventilators, PPE. Already the waste is being produced even now, but even later, and a lot of vaccines. I can tell you that in the example of the influenza, they produce millions of doses of influenza vaccines for a certain $1 billion, and they were all wasted. We know this, that happened at least in US, and this will be another waste. So vaccines, drugs, PPE, and the ventilators, which have become the so-called the mascots of the COVID-19 technological response, are all going to cause the additional environmental challenge as well as financial drain. And finally, I would say, given the economy that the world finds itself in, and particularly the poorer countries of the world, which Asia and Latin America, abound in, I think lives all across would be endangered. And I think I am very worried, much otherwise a little better endowed than most of the poor people in India or in Asia. What is going to be the life of people, and until we really restructure our ways of thinking, of our governance structures, and how we spend the money and whom we spend it for, we are entering to a doomsday.
So there is directions for civil society activism. Carolina?
Yeah, I think I agree totally with Yogesh. I would add two things. One that's negative and one that's positive and gives me hope, at least in the region. So the negative thing is that COVID will pass, right? And I don't think we took the advantage to learn and do stuff to tackle with other neglected diseases. With the COVID is not neglected, right? So, and at the end, we will remain with those diseases in our tropical countries that are far worse than COVID, right? So we've made all these huge efforts, and I think we had to do them. I mean, we had no choice, but still, it's painful to see, right? You feel it in your stomach, like you still have people dying from TB and people dying from malaria, and this has done nothing, I think, to change that. So it's sad, and all this infrastructure that we built and the strengthening of healthcare system that we're doing for COVID doesn't work, does not function for these diseases, which are the real burden of our countries, right? And also violence in my region and in Colombia. So it's still more dangerous to be a social activist in Colombia than to have COVID, right? So, but and the other thing that is giving me a hope that I'm starting to see in Latin America is that, so there was a lot of social unrest before the pandemic in the region. And there was a lot of social unrest, against right-wing governments, and people were fed up. We were having major protests and major strikes. And if people felt awake, I think. And then the pandemic came, and I think this was, as we say, in the Christian tradition, this was an apparition of Virgin Mary for governments. So Virgin Mary came and performed a miracle. This is a term we use, because all those protests and that social unrest would just put down, and then we're focused, and let's forget about those troubles that were making people mobilize. Let's focus on COVID. And this is the only point in the public agenda, and this is the only thing we talk about, right? Let's forget about poverty, hunger, violence, injustice, right? But I think now that lockdowns have started to be less strict in the region, I feel this call of people saying, oh, we're just waiting to be allowed to be out again, to mobilize and protest and not conform. So that gives me a little hope, and I think in some at least in my country now, I feel it's the only solution to many things we're seeing that are not COVID related, but are related to intolerance and to this war and peace process failing because of the government wanted it to fail. So there's just protests, we have the streets. So we'll see how it plays, but I feel it in the region also. In Chile, we're seeing it. In Central America, we're seeing people wanting to protest and mobilize.
Thank you. So I can't help but use Carolina's point that she made to bring into a conversation about the tricontinental global south, the great elephant of the global north, and underline that the past few months have seen in the United States, in addition to a failed government policy level response to the pandemic, an extraordinary upsurge of protests against systemic racism, exactly of the kind that Carolina is talking about. And clearly, therefore, if this can happen in the United States, it can happen in other countries with the extraordinary diversity of vibrant social activist movements that the Global South represents. So the pandemic is here. It has shaped and warped our political system responses to a very substantial extent, as we've discussed. And it has left consequences that social activism is going to have to deal with in the post-pandemic era as we go forward. Unless our colleagues have last thoughts to add, this would be a good point for us to stop. Yogesh, Carolina?
No.
If not,
No, thank you.
Then
Thank you, Professor Raj.
Thank both Yogesh and Carolina, and I again underline how deeply we feel the absence of our colleague from South Africa, Sibongile Shabalala, and we thank everybody at NewsClick for doing the behind-the-scenes organization, and with these thoughts that not simply during the pandemic, but in the post-pandemic era, here are the structures that social activism, civil society struggles are going to have to address with, as Carolina said, lots of hope. I bid everybody goodbye. Thank you very much.
Bye-bye. Thank you. Bye-bye.